Could two overlooked nutrients calm your mind, lift your mood, and help you think more clearly without the side effects you're trying to avoid?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at how magnesium and vitamin D are reshaping mental health care by targeting brain chemistry, inflammation, and stress response.
I'm Alara Sky. Depression affects about 280 million people worldwide, anxiety about 301 million, and in the U.S., nearly 1 in 5 adults faces a mental health issue each year. You hear a lot about medications, but these two nutrients have clear documented roles in mood regulation and are often low in people dealing with symptoms.
Magnesium sits at the center of neural balance. It helps control NMDA receptors, so glutamate doesn't overstimulate your brain, supports GABA to steady your nervous system, and promotes neuroplasticity by influencing brain-derived neurotrophic factor. When you run low, you feel it as restlessness, racing thoughts, poor sleep, and slower cognitive recovery from stress.
Magnesium also stabilizes your stress response system. Deficiency drives up corticosterone in animal models and produces anxiety-like behavior. Clinical evidence shows supplementation reduces subjective anxiety across different groups. Low intake correlates with more depressive symptoms, and restoring magnesium improves mood in people with mild to moderate issues. Deficiency is common. Over 45% of Americans may be short, and standard serum tests often miss it because most magnesium is inside cells.
Vitamin D is equally involved. Receptors and activating enzymes appear in key brain regions tied to emotion and behavior. Vitamin D crosses the blood-brain barrier, is metabolized locally, and supports nerve growth factors like BDNF, NGF, and GDNF. It also helps synthesize dopamine and tempers neuroinflammation by modulating immune signals, which matters because chronic inflammation tracks closely with mood disorders.
Low vitamin D status shows up consistently in people with depressive symptoms across age groups. The pattern is clear. When vitamin D is suboptimal, you're more likely to report sadness, low motivation, and reduced interest in daily activities. Optimizing levels is a low-risk way to support emotional steadiness and cognitive function.
These nutrients don't just run in parallel, they depend on each other. Vitamin D enhances magnesium absorption, while magnesium converts vitamin D into its active form. When either is low, the other underperforms. Adding vitamin K2 strengthens this network. People not taking magnesium and K2 can require over twice as much vitamin D, about 244% more, to reach similar blood levels compared to those who include both. Magnesium also buffers calcium signaling, so vitamin D-driven calcium uptake stays in a safe range.
When used together, the benefits become measurable. In a randomized trial with obese women who had mild to moderate depressive symptoms, 8 weeks of combined vitamin D and magnesium improved mood and shifted markers like BDNF and inflammation in a favorable direction. Another randomized study in children with ADHD found that pairing vitamin D with magnesium improved emotional problems, peer difficulties, and total difficulties, especially when baseline levels were low.
If you want to raise vitamin D effectively, start with sunlight. Midday exposure on bare skin without sunscreen is the most efficient way to synthesize vitamin D3 and carries benefits that go beyond what supplements alone provide. Many outcomes historically attributed to supplements, better psychological measures, lower mortality, track closely with sensible sun exposure.
There's a key step before you expand midday sun. Remove industrial seed oils high in linoleic acid. Linoleic acid makes your skin more vulnerable to UV-induced oxidative stress. Keep total LA under 2% of daily calories and eliminate soybean, corn, canola, sunflower, safflower, cottonseed, and grapeseed oils. Favor fats like grass-fed tallow, butter, and ghee. Give your body 4 to 6 months to clear stored LA. In that period, choose early morning or late afternoon sun and delay midday sessions.
Sun needs vary. Darker skin requires longer exposure, Because melanin blocks UVB. Higher body fat increases the need for frequent sessions because vitamin D is fat-soluble. Use the sunburn test. Stop at the first sign of gentle pinkness, never a burn. During daylight saving time, plan around solar noon near 1 p.m., when UVB is strongest from roughly 10 a.m. to 4 p.m. A simple cue is your shadow. When it's shorter than you are, UVB is adequate.
Protective adjuncts can help if you're still clearing seed oils or need peak hour exposure. Astaxanthin at 12 milligrams daily increases UV resilience. Topical niacinamide before sun can reduce UV-related DNA damage. A baby aspirin 30 to 60 minutes prior may blunt the conversion of linoleic acid into harmful oxidized metabolites. Another option is pentadecanoic acid, C15:0. At about 2 grams daily, it's reported to displace La in skin cell membranes and accelerate clearance from fat stores, with some evidence of a 25% to 30% skin La drop within 3 to 4 months. Combining it with strict La restriction may shorten the overall clearance timeline compared to diet alone.
Supplementation still has a place. If latitude, indoor lifestyles, or season keep you from reaching target levels, use vitamin D strategically and aim for 60 to 80 nanograms per milliliter. The point isn't chasing a pill. It's reaching a physiologic range that supports mental health while you maintain sensible sun habits.
On magnesium, food alone often falls short. Modern agriculture has depleted soil magnesium, leaving produce less nutrient-dense, and only about 30% to 40% of dietary magnesium is absorbed. Stress, gut issues, and stomach acid levels reduce that further. Despite their magnesium content, nuts and seeds are discouraged here because they're high in linoleic acid. Supplement forms matter. Glycinate for calm and sleep, malate for energy support, and L-threonate for memory and focus are recommended for ongoing use. Magnesium oxide isn't advised due to poor absorption.
Put it together and you have a clear path. Pair magnesium with vitamin D, remove seed oils to improve sun tolerance and vitamin D biology, and use targeted forms and doses that match your needs. You're not guessing, you're addressing neural excitability, neurotransmitter balance, inflammation, and stress reactivity in a coordinated way. Here's your challenge. Over the next 30 days, eliminate seed oils and keep linoleic acid under 2% of calories. Schedule short midday sun sessions guided by the sunburn test, and begin one well-tolerated magnesium form, glycinate, malate, or L-threonate, at a consistent daily dose. Track mood, sleep quality, and daytime focus in a simple log, and aim your vitamin D into the 60 to 80 nanograms per milliliter range through sun and, if needed, supplementation. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.